Joining us now is Dr. Jamie Taweel. He is an internal medicine specialist at Grand River Medical Associates. With us once again on the MegaCast, Dr. Taweel, thank you for being back with us.
How you doing?
Doing well. How are you doing?
I'm getting there. It's been an interesting couple of months, but we're doing all right.
It has been. It seems like now, with case numbers starting to trend back downward, that it seems that we are on the back end of that major surge we had with the Omicron variant and kind of that mixture of the Omicron variant and the Delta variant here in the state of Michigan. So at your practice and in the local medical community around you in southeastern Michigan, where are we in terms of addressing the COVID-19 pandemic, and more importantly, the stress that the pandemic during this most recent surge and all these surges we've had really have put on our medical community?
Well, things are starting to slow down a bit, and thank the Lord. You know, the Christmas, the holiday season, things went through the roof. We had a huge surge that was out of control, and everyone got it, myself included. Actually, I managed to pick up COVID somehow, and that all happened during the holidays. The majority of the people got it during the Christmas, New Year's time, and a little bit thereafter. But it looks like it's now trending down. So I think a lot of the strain that's happening to the healthcare systems in the area are starting to ease up a little bit. I was reading a statistic today where typically COVID cases were taking up to 23% of hospital beds. It's now down to about 12%. Don't quote me on those numbers. It was something I just was reading a little bit earlier today, but it looks like it's starting to trend down. We're not out of the woods yet, but we're definitely making improvements.
And so and on that note, too, one of the ways that we are able to make some of those improvements, or at least relieve some of that stress that's put on our hospital systems, on our medical community in the times of these surges, and even outside of those surges, is through vaccination and through the booster shots. Dr. Fauci recently said, as did other medical experts, they stated that it seems the effects of the COVID-19 booster shots that are available, they start to wane after about 4 months. Would you imagine that? Have you been hearing that at all? And if so, if you're hearing something similar to that, would you imagine that the COVID-19 booster shots, and we've heard so many times that this may just become something similar to your annual flu shot, would in this case maybe be something that's more often needed than the flu shot until we get to a point where maybe there is that booster once a year and these variants aren't spreading so quickly?
I don't know 100% about that, but I do feel that the booster shots are going to be a little bit waning. I think that again, the amount of people that I've found that have been getting COVID has gone up significantly as of late, specifically, again, over the holidays. And a lot of those people had been vaccinated. So I do feel that the booster shot might be wearing down a little bit. And I have no doubt in my mind that it's going to be something that we're going to have to get recurrent. We're going to have to keeping up against any variants that come up. It can be a little bit frustrating to keep receiving booster shots, but I feel like it will be an annual thing. That's, again, my words, not anyone else's. It's just my thoughts. But it seems as if that's the case. However, I do feel that people that have been vaccinated and boosted are getting much, much less severe cases of COVID. I mean, a lot of the people that have gotten COVID that have been vaccinated and boosted have had very mild cases, mild upper respiratory symptoms, fatigue, loss of sense of smell, and otherwise have been doing pretty okay for the most part. We're also seeing significant amounts of people that are trying to get the treatments like the monoclonal antibody treatments and things like that at the local hospitals as well. And some hospitals are allowing it and some hospitals aren't, but it seems to be improving people along the way.
We're joined by Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, with us on the MegaCast. Dr. Taweel, another issue we've heard a lot about throughout the pandemic, especially as things have started to open back up, is that continued reluctance that some may have been having to go see their doctor, to get those annual checkups, to go in for those ailments and those aches that they may need to get checked by their doctor or by a specialist. Have we seen that sort of issue wane a little bit in recent months as things have continued to open back up, and especially now as we're starting to see a dip in coronavirus cases as we're coming out of this most recent surge with the Omicron variant?
So I have seen, when COVID first hit, people were avoiding all types of preventative care. People weren't getting their colonoscopies. A lot of that was due to hospitals closing down their elective surgeries. People weren't getting mammograms. People were afraid to get imaging because they didn't want to go to those hospitals because of the overwhelming burden that was on them from the the variant wave, I'm now starting to see people starting to open up a lot more. So we are getting a lot more preventative cases back in. This is starting to become more annual physicals and not so much head colds and COVID. So it is picking up a little bit. There are people that are still trying to avoid it. There are people that have a lot of significant comorbidities, people that are high risk that are still avoiding going out there. And I can understand that, respect that. Excuse me. We are still doing there's still a lot of physicians that are doing virtual appointments to try and keep things along, but it doesn't replace, getting labs, getting a stethoscope on you, having a doctor examine you, making sure that everything's okay. Hopefully I'm answering that question for you.
Yeah. And among those checks that you're getting when you're going to your doctor are, of course, respiratory checks and some basic cardiac checks as well. This is American Heart Month. And so we're trying to keep our hearts as healthy as possible. It's raising awareness for that. And of course, stress, a big factor in cardiac health. And we've had a number of different additional stressors in addition to all those normal things come into play over the last couple of years. Have you noticed an increase in patients with some heart ailments as a result of some of those stresses or compounding stressors and factors during the pandemic or more recently because of either inactivity or added stresses or other factors in the last couple of years?
So yeah, I have noticed a lot of, let me say that just for, again, anecdotally
Sure.
here, what I am seeing a lot more of is patients that are having a lot more chest pain. People have gained a lot of weight during COVID. I'm no exception. And they've been a lot less active. People are working from home and it has changed a lot of their lifestyles. So I am seeing patients that are having a little bit more significant symptoms of chest pain, either it be from them being sedentary versus otherwise, but there's also been some increases in cardiac things. But I also think that's because people are starting to come back out of the woodwork and going to the doctors. We are catching some things ahead of time. We are also seeing a lot, I'm still seeing a lot of patients that are coming in after their hospitalization for an unfortunate heart attack. So it's picking up a little bit. And I think it's also because we're now looking at it a little bit more. We're now able to accept the bandwidth of being able to see patients for other things other than just COVID. I know the cardiologists that I work with are busier than they have ever been. So it's just been, I think, a lot of catch up, so to speak.
And so we hear a lot about different risk factors that can increase your chances of heart disease or of cardiac issues, things like living a sedentary lifestyle, like a high cholesterol or high salt diet are among some of those things that can lead to cardiac issues. But what are some more uncommon things that or activities or factors that people may not be considering that can often lead to heart-related issues?
Absolutely. So the things that you want to be really, really aware of is family history. If you have a family history of heart disease, you got to be on the lookout because that can always be an issue for you. If you have high cholesterol, if you have high blood pressure, diabetic is a big, huge risk factor. So if you're a diabetic and you're not having good control of your blood sugars, that can be a significant problem for you. So you really want to try and keep your sugars under control. You want to make sure that your diet is going to be low in cholesterol, get your cholesterol checked, all that fun stuff. Another huge one is smoking. And bear in mind, smoking is, the carcinogens in the tobacco is always going to cause lung damage as well as heart issues, but the nicotine is what's also causing heart issues as well. So people that have switched from cigarettes to vape pens, for example, or vaping devices, there's still nicotine in that, which can increase your risk for heart disease. So, people that often feel like, hey, I'm moving towards a more safer alternative for cigarettes. While you are moving in a good direction, there's still a lot of things out there that is really bad about those things, and they can sometimes even be worse in certain cases. But let's not reduce the fact that it can also continue your risk for heart disease as well. So please, if you can, if you're a patient and you have a family history or you're smoking, diabetic, high blood pressure, try to get those under control as best as possible, or else, that's going to come for you, unfortunately. We got to try and reduce that risk as much as possible.
And we've also heard a lot over the course of the pandemic about people maybe increasing their alcohol intake as well from being maybe casual, a few drinks per week pre-pandemic to when they were home more often during the pandemic. They didn't have as much to do. They were on their own time, having their own fun, and maybe indulging a little bit with alcohol. How does alcohol consumption and that lack of moderation or change in what they consider moderation affect heart health?
A lot of ways. First and foremost, let's not forget the fact that alcohol has a significant amount of calories, so weight gain is going to be a big factor. Alcohol consumed in excess will also cause your blood pressure to rise significantly, and that is going to cause a significant amount of stress to your heart. Patients that drink quite frequently will also find themselves putting themselves at higher risk for atrial fibrillation, which is an arrhythmia of the heart, which can cause further heart problems down the line. Increases your risk for sleep apnea, which can cause stress on the heart. It can also just a plethora of risk factors. And I am seeing a rise in alcohol consumption due to people being at home more often, due to people having increased anxiety over this entire pandemic and being at home. Being at home full time and working from home is stressful. You're not away from your office. Your office is at your house, and it's difficult to relax. The stress of family can sometimes just compound it, because sometimes family plus work do not mix well. It can be a lot. So trying to reduce alcohol consumption is going to be a big thing, because it can definitely impact your heart in multiple ways.
So if people that may be considering themselves to be, generally speaking, healthy, or may not feel like they have cardiac issues or having heart problems, but may have some risk factors, what should they be looking out for in terms of symptoms, in terms of feelings that they may experience that may be either symptomatic or at least maybe just be basic indicators that a problem could be oncoming, or that they are currently experiencing some cardiac issues?
Absolutely. Well, it can be different for everybody, but the common I'm having heart problems is going to be, chest pressure, sometimes can go up the neck or down the left arm, can sometimes have shortness of breath, nausea, sweating. Those are big indicators. Those are, I need to go to the ER immediately. However, subtle signs of heart disease include difficulty breathing, or I'm feeling significantly fatigued when I'm doing things that normally were not a big issue. We get a lot of patients that are, they sit around for a long period of time. They've been sitting home because of the pandemic. It snows. They go outside and they start shoveling. They suddenly exert themselves to a significant amount, and they can really cause problems. We see a lot of heart attacks from that, as well as people that are like hunters that are in the woods, drinking booze and just minding their own business. And then they shoot a deer. Now they have to drag 100 pounds across the forest in the middle of winter. It can sometimes cause some heart issues as well. Things that you're going to want to look for before those big events are going to be anything that's sudden or different. So I get a lot of patients that come in and go, yeah, I'm a little short of breath, but I think it might just be due to age. But if they weren't short of breath a few months ago and suddenly it's starting to become a big deal, like going up the stairs, I'm feeling really tired and fatigued, and I'm getting a little sweaty, palpitations, lightheadedness, dizziness, headaches, things like that. Those are all subtle signs that you could be having some heart issues, and you should get that looked at.
We're joined by Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, joining us on the MegaCast. And Dr. Taweel, over the past weekend, a Detroit radio, longtime Detroit radio broadcaster, Frank Beckman, passed away, and he had died of what was termed vascular dementia. Can you tell us, what is vascular dementia, and then tell us what can cause that condition in somebody?
Certainly, and it's sorry to hear about that. My heart goes out to his family. The vascular dementia is a subset of dementia. Dementia has multiple causes, the number one cause being Alzheimer's dementia, but there's a subset called vascular dementia, which is dementia caused by any type of issues with regards to blood flow of the brain. So anyone that has a stroke with mental status changes beyond that will have issues that can be considered vascular dementia. People that have really bad coronary disease or really bad vascular disease, so they're not getting blood flow to particular areas of their brain, that can cause vascular dementia. People that have heart disease that aren't getting enough blood flow to their brain, people that are having multiple emboli that are really small, they're like very small infarcts, or, very small occlusions in their brain that are not going to be noticeable by a stroke is pretty obvious, but multiple tiny little strokes like that kind of present themselves as dementia. The difference is based on diagnostics is going to be imaging. So when you do an imaging of the brain, you'll see that there are areas of the brain that aren't getting blood supply, and there's inflammatory issues that are going to suggest that they have vascular dementia. So it's just dementia caused by other factors other than Alzheimer's. And you can even have a mixed picture that can make things a little bit worse.
Dr. Taweel, any other medical issues that we're seeing becoming more common across the board, or things that our community should be aware of going forward?
Just the usual stuff. You want to make sure that you are being, staying up to date on all preventative testing, colonoscopies, mammograms, getting your heart checked, getting your diet corrected, make sure your diabetes is controlled. We're still in this pandemic, but we are getting better. So I'm very pleased to see that this is improving, and the cases that I'm seeing are much more mild. This has been a godsend. So hopefully this continues in the right direction. I think we're going to continue to do well and get past this and hopefully get back to normal lives.
Dr. Taweel, thank you very much for joining us.
Thank you. Thank you for having me as always.